All right, so now that we've completed our examination, biggest thing is if I see at least one risk factor, one indicator, I would go ahead and recommend the sleep study test. There is no risk to the patient, and is the best way I describe it to providers is you go to a medical provider to do blood work every year. Not necessarily because you have something that you're looking for, a condition or disease, but rather just a normal check. In my opinion, at a certain point in life, you should always do a sleep study because like 70% of the population are often undiagnosed or thinking that as they get older, it's just due to age that they feel tired. When in reality, there's a disease that is at play. So as general dentists upstairs, our responsibility, our role is not just looking at the teeth, but looking at the whole oral cavity, looking at the person as a whole individual. So we don't want to just their teeth and then all of a sudden they have a car accident or they have a heart attack because we didn't do our due diligence of offering a sleep device that is of reasonable price, and it gives them a lot of information that will kind of help them with the quality of life. Okay, so this device, I absolutely love this device. We tried many different sleep studies, and I find this the most comfortable and the most effective. The way the device works is for patients, they just need to find one day that they can get good quality of sleep, so that way we can have as much data and much information as possible. We always recommend at least 6.5 hours in order for the information to be accurate and thorough. Patient compliance, this is actually really good. The way that these watches work, and a lot of times we want to train the front staff, so when we recommend a device and they're interested in purchasing it, the front staff can kind of show it and talk about it. The beauty of this device is there's a QR code that shows step-by-step instructions of how to wear it. So once properly trained, this shouldn't take too much of your schedule. The way this works, you want to put the watch on your less dominant hand when you sleep. You want to wrap it around your palm. You want me to do it or? Sure. Okay. Would you be able to take your watch off for this demonstration? So for this watch, what you want to do is put it on your least dominant hand. It ends up being a little bit more comfortable, especially when you're sleeping. So then, go ahead and put it here. And then you tell the patient that they will be downloading an app, and then they want to make sure that their phone is on and plugged in at all times. So the wonderful thing about these devices is when there's a QR code that you can scan so that they can rewatch the videos and make sure they're doing it properly. You want to make sure that they have, you can go ahead and put your hand down. You want to make sure that when they are using the watch, their phone is on with the app on and fully charged. Don't have it unplugged so that way it doesn't burn throughout the night. If you wake up in the middle of the night to use the restroom, perfectly fine, so long as your phone is within the same vicinity or room of the device or where you're going. Next thing you want to do is there is a sticky tab here that you would peel. And then what you do is you place this at the sternum. So you have the patient kind of lift up. Usually you put it underneath their shirt so that way when they're rolling around, they're not tangled up. And you kind of place it right over here. This gives us good information, but don't rely on just the stickiness there. Get some tape and tape it down because you only have one shot at this. You want to make sure it's done properly and correct. With that in, the last piece is the pulse oximeter. You want to put it in a finger that feels comfortable, not too tight where it compresses their blood flow. A lot of times for larger gentlemen, I usually recommend the pinky or the ring finger, and then they would just wear that throughout the night. One thing that you want to let, especially with women, is make sure they don't have nail polish. The nail polish or acrylics, it affects the sensors and the data. So you want to make sure that's off.
The length of the nail, what about length of the nail?
The length could, but I think so long as this part is inside where the gold is, it should be fine.
Have you tested this on people who have ladies who have long nail, is if it's still working or not?
Whenever I see that, it's because they have acrylic, and I tell them that if you're gonna get a pedicure, go ahead and take it off that day. And then you wanna make sure that they don't have like a pacemaker. If they have a pacemaker, these devices might not be the most accurate. We haven't run into that issue yet, but it's something that the company has told us to avoid, or maybe not just avoid, but understand that the data might be skewed. And then a lot of times when you show these devices, the video is about 4 or 5 minutes long. They have multiple languages, so that way there won't be a language barrier. And then we set it up before they go. And ideally, we tell them we need at least in our mind, we need at least a week before the consultation that they have to do it. I always tell patients, especially if it's like the Friday or Saturday of that week, go ahead and do that. And then when they get scheduled in, we'll have all that data. Okay? As providers, we need to be aware of is there's a spectrum of sleep apnea. We categorize as mild, moderate, and severe, and that has to do with the AHI value. So it is normal to have at less than 5 events. That is considered normal. It's not sleep apnea. When patients come in and you see that result, it doesn't necessarily mean that we can't do treatment for them. If their primary concern is clenching or grinding or is snoring, then we would treat it as a snore guard. These appliances, when you protrude the mandible, you address the snoring in that way. Billing issue, that's a whole different issue. That it would be out of pocket if they address the snoring. But if it's mild and moderate, those are the cases where these appliances work great. The sleep physician that we work at that does the interpretation recommends the oral appliance as almost like the first line therapy. Severe sleep apnea patients are a little bit trickier. You have to be aware that the gold standard, especially for severe cases, is the CPAP machine. Those are cases that I run into quite frequently, and the way I address that is having them understand that the CPAP is the first line therapy. You can also do combination therapy, where if they already are using a CPAP machine and they can't tolerate, figure out why they can't tolerate. Is it because the pressure is too high? Is it because of the noise? A lot of times if the pressure of the oxygen is too forcefully or too aggressive because they're too severe, you can do combination therapy where you protrude the mandible with the devices, the sleep appliance that we offer, and we can decrease or titrate the pressure downward. Patients find that that works well, or patients have been diagnosed as severe and they choose not to use the CPAP machine. If that's the case, our sleep physician has supported that, saying if they deny treatment with a CPAP with severe sleep apnea, we can treat it, but they have to sign a consent form, patient understanding form. With that, in my definition, using an appliance versus not using an appliance, it's still beneficial. The reason by definition it's not successful is because it may not be able to bring your events down to 0. But in my opinion, if you have 50 events throughout the night, you bring it down to 15, I would still consider it a success. But for liability's sake, you have to make sure they sign that waiver understanding that the treatment is necessarily not complete. You need to have other form of therapy.